Good morning, everyone. Thank you for joining us for our State and Local Health Department Industry Day. We are kicking our day off with one of our really close partners, the Maryland Department of Health. Today we have Sandy English, who's going to be telling you a little bit more about the organization, different opportunities, and how you can stay connected. So, Sandy, if you want to go ahead and introduce yourself.
Well, good morning, everyone. My name is Sandy English. I am Deputy Chief of Recruitment Outreach here at the Maryland Department of Health. And I am also joined by Wendy Lott, who is also part of the recruitment outreach team here. All right, let's go ahead and get started. Hopefully everyone can see my screen. Okay. Okay, so I'm just going to give you an overview of the Maryland Department of Health. Today's topics, you just learn about the Maryland Department of Health, opportunities with MDH, the benefits of working at MDH, the application and recruitment process, and some tips for applying. All right, well, so we'll start with our overview. So the vision of the Maryland Department of Health is for a lifelong health and wellness for all Marylanders. Our mission is that we work together to promote and improve the health and safety of all Marylanders through disease prevention, access to care, quality management, and community engagement. MDH provides public health and healthcare services through various state programs, through the local health departments, state-run hospitals, and residential centers, and contracts with private sector healthcare providers. So this is just an overview of our org chart here at the Maryland Department of Health. As you can see, it's headed by the governor and our secretary, Dr. Laura Herrera Scott. As you can see from the secretary, we have the Public Health Services Administration, Developmental Disabilities, Behavioral Health, Healthcare Financing and Medicaid, the Deputy Secretary for Operations, and several different assistant secretaries. See, the Public Health Services Administration is headed by Dr. Nilesh Kalyanaraman, and under the Deputy Secretary for Public Health Services, we have our laboratories, I mentioned the 24 local health departments, Office of the Chief Medical Examiner, Provider Engagement and Regulation, Healthcare Quality, Population Health Improvement, and one of our largest administrations, Prevention and Health Promotion, and then Vital Statistics. Then, as you can see, our Developmental Disabilities Administration, which has several regional offices, federal programs and integrity, fiscal services and operations, Office of Policy and Programs. And then next we have our Behavioral Health Administration. And we have clinical services, systems management, system access and practice innovation, child services. And see the suicide prevention is housed under Behavioral Health Administration. Then under Healthcare Financing and Medicaid, we have eligibility and enrollment, provider services, medical benefits management, pharmacy services, long-term services and supports, total costs of care contract, and our Maryland Primary Care Program. Then under our Secretary for Operations, we have the State Hospital Administration, court-ordered evaluation and placements, central services, facilities management, Office of Preparedness and Response, safety and secure transport, Office of Contract Management. As you can see, these are different facilities and state-run hospitals. Most of our facilities and hospitals are for psychiatric patients, for behavioral health. We do have some facilities that are for clients that have developmental disabilities. We have one chronic care facility, and then we have two regional institutes for children and adolescents. These are residential treatment facilities for children and adolescents that have behavioral and intellectual disabilities. And see here is the breakdown of all the different counties throughout the state of Maryland. This represents all of our local health departments. We represent most of the local health departments, at least through our hiring efforts, the exception of Montgomery County, Baltimore City, and Baltimore County, and Prince George's County. Those are independent. And if you have any interest in positions with those particular counties, you would have to apply through the county rather than the state. But we do, share programs and other activities with those counties. Just in terms of employment, you would have to apply through those counties. And our boards and commissions. We have several boards and commissions that fall under the Maryland Department of Health. All of your health licensing boards fall under us. Your board of nursing, social work examiners, board of morticians, anatomy board. So several different boards listed here. Okay. And these are just some videos that you can check out about some of our different roles that we have here. Let's see. I can share those videos with you all later. I'm unable to get them to play from this. Here we go. So these are just some snippets about different career paths here at the Maryland Department of Health. So I'll just play a few of these for you all. Here we have a testimony from one of our health educators.
Andy, we're unable to hear the audio.
Oh, I'm sorry.
It's fairly faint.
And
Let's see.
provides
Is that
resources
louder?
for testing.
Yes, thank you.
Okay, should I start it over?
Yes, please.
Okay.
My name is Maria Segale. I'm a health educator for the Maryland Department of Health, Center for STI Prevention. I am a health educator, so that means that I help educate and raise awareness about STIs. My role in my work helps prevent sexually transmitted infections and provides resources for testing and treatment of STIs. There is no time like the present to enter the public health field. There's just something deeply rewarding about trying to leave the world a better place. We're from the Maryland.
Okay. And then we'll also have one about research development.
And what those are man-made chemicals, sometimes household items, firefighting foams, Teflon, non-stick programs. On a daily basis, I'm working with the to organize this. If anyone has ever considered potential career in public health, we're Public Health Maryland.
Yep. And then I'll play one more for you all, and then I can provide the link to all of these later if you all want to take a look at all the other ones that are here. So we'll do the creating person-centered systems in public health.
My name is Nick Burton. I'm the Director of Programs for the Developmental Disabilities Administration. I collaborate with advocates, families, and stakeholders to create, enhance, and implement supports and services for people with developmental disabilities so they can live, work, and play in their own communities. Every single day, I walk in the door and I get to work with an amazing group of people that are dedicated to our mission of creating a flexible, person-centered, family-oriented system of support so people can live their lives. Public service is good work. We get an opportunity to make a difference every single day. We are a public health movement.
Okay, so that just gives you a snapshot at some of the positions that, or some of the things that you can do at the Maryland Department of Health. We have so many different roles and so many different career paths available. Here you can just follow us on social media, on our, well now X, YouTube, and Facebook, and check out the rest of those videos. So now we'll go into the different opportunities, the types of jobs, career paths available. So just to get you acquainted with how our system is set up, we have merit positions, which are our permanent positions, contractual positions, which are temporary, usually 6 months to a year, but they can be renewed. At-will employment, which is our special appointment, management service. Those are positions where you usually serve at the pleasure of the appointing authority, meaning the pleasure of the governor. We have our internships, and then we have temporary positions or temporary emergency positions, which are similar to contractual roles. However, those positions, once you've served your time in that role, that position cannot be renewed. So usually temporary positions are 6 months and do not extend beyond that 6 months. So here are some of the different public health career paths that we have. As you saw in the video clip, a testimony from one of our community health educators. So we do have the community health educator track, one being the entry level to that series. So as someone starting out with either little to no experience, you would start off as a community health educator 1. We have our community health nurses. Again, 1 indicating the entry level. Our coordinator special programs. We have 4 different focus areas for the coordinators, which are addictions, developmental disabilities, health services, and mental health. These reflect the different administrations within the Maryland Department of Health and the different programs that they support. We also have our dietitians and nutritionists. We have epidemiologists, again, 1 being the entry level to that series, just requiring that you have your master's degree in public health with certain courses in epidemiology and biostatistics. Then we have our environmental health specialist series, our health policy analyst series, the associate actually being the entry level to the health policy analyst series. We have our program administrators. Again, just like the coordinators, there's 4 different areas of focus, which are addictions, again, developmental disabilities, health services, and mental health. This is a more experienced level position, the program administrator. So coming into this series, you would have to have some experience with that. The public health laboratory scientists, again, starting with the 1, our registered nurses, and then our social workers. We have a social worker health services, and then we have social worker health services CI, meaning court involved. Court involved indicates that you will be working with forensic patients in that capacity. And I see someone's raised their hand.
Hi, can you hear me?
Yes, I can hear you.
Hi, my name is Tashiana Phoenix. Thank you so much for being here today. I had a question. So with the health policy analyst 1 position, so given that it's not entry level, what sort of experience or years of experience do you have to have for that role?
So with the health policy analyst series, actually at a 1, if you have your master's degree, you would still qualify without having that experience. But that associate level is truly the entry level, although it does require a little bit of experience. So with the Health Policy Analyst Associate, it starts off requiring a bachelor's degree and 1 year of experience with quantitative and qualitative analysis. As you move into the more intermediate levels, the Health Policy Analyst 1, it requires a bachelor's degree and experience that's more geared towards health and more specific experience rather than just a broad quantitative and qualitative analysis. But you can substitute your master's degree for that experience for the Health Policy Analyst 1. With each of these levels, you can substitute the master's degree for some of the experience. So a lot of our MPHs come in as Health Policy Analyst 1s.
Got it. That makes a lot of sense. And then also, I had a question earlier in terms of the counties that are independent. Can you repeat what those counties are?
Sure, that was Baltimore County, Baltimore City, Montgomery County, and Prince George's County. Now, we do have a few state positions at Prince George's County Health Department. Those typically are not of the more professional level positions. Those are typically like building services type roles.
Got it. Thank you.
You're welcome. Okay. And then here are some additional career paths that may not fall directly under public health, but they support all of the different programs just the same. So we have our accountants, administrative officers, administrators, which I'll take a moment to highlight the administrative officer, administrator classifications. Those are more generic classifications. They're used in a wide variety of ways. So there may be some positions that fall under those classifications that you're interested in. So there may be an administrator that's doing some policy work along with some other things, or some community health education, or doing some sort of like program about, So I would also, in looking at our positions, look at those administrative officers and those administrators as well. Moving on, we also have our agency budget specialists, our agency grants specialists. Then we have some of our IT roles, like our computer information services specialists, database specialists. We have our direct care assistants. A lot of times people, if they're still in the early stages of nursing school, they may start off as a direct care assistant while working towards becoming an RN or an LPN. We have our fiscal accounts clerks and technicians, IT functional analysts, programmer analysts, and then our office clerks and other clerical roles. So our office secretaries, administrative aides, management associates. So these are just some additional career paths within the Maryland Department of Health. And again, this is just a small portion of what we do offer. We have a very extensive list of job classifications. There are just some that we tend to hire more than others. So benefits of working for the Maryland Department of Health. I'm just going to go over our leave, health insurance, and some other benefits. So our health benefits include vision, prescription, dental, mental health, substance abuse, term life, personal accident and dismemberment, flexible spending accounts for health and for childcare, long-term care. We offer retirement, and then our leave. So we have 12 regular holidays, 13 during election years. We start off with 6 personal days each year. Actually coming up in 2024, because it is a leap year, we will have 7. Annual leave is accumulated based on your length of service. So for example, if you've worked 6 months through 5 years of service, you earn 10 annual days each year. But as your length of service increases, so do your annual days. Sick leave is earned at a rate of 15 days per year. So, starting off, you could start off with about, in your first year earning, you have like 30 something days of leave, and then you also have those state holidays. So we also have paid parental leave. Again, mentioning the flexible spending account, we have reduced child and healthcare costs. We do offer a student loan forgiveness for certain types of roles, usually for our hard to fill, hard to retain classifications. So that's sort of on a case-by-case basis. It's not widely available, but we are working on some other benefits for employees in terms of education. We do have flexible work schedules. Right now, a good portion of our offices are involved in hybrid work. So a lot of people are teleworking a percentage of the time and then working in an office some days. So for example, in my office, we work in the office 2 days per week, and then we telework 3 days per week. But this varies across the organization depending on what kind of work that you're doing and how your team works. Especially if you're at one of the facilities, that option may not be available, especially if you're in a clinical role. We offer free mass transit within the Baltimore metropolitan area. So those that work within the Baltimore area can take the light rail, can take the subway, can take the bus for free. And then contractual employees are eligible to earn limited leave benefits and healthcare coverage. So there are some benefits available to contractual employees.
Yeah, in theory, yes.
And the application and recruitment process. How do I apply? So in order to apply for our positions, of course, you'll have to visit our jobs page or the MPH's homepage. So our actual page where you find our positions is jobappscloud.com/MD. It's where you find all state positions. Here you can narrow it down to Maryland Department of Health. And as you can see here, we have several different positions listed. Currently, we have 102 positions available, from alcohol and drug counselors, some of those administrative titles that I mentioned, administrative officer. We have coordinators. We have a mental health coordinator open right now. We have our epidemiologist, environmental health specialist. Again, some more coordinators. And just please be mindful that sometimes our positions, you may be looking for a certain classification. So you want to be an epidemiologist. So you go and you're looking, everything's listed in alphabetical order. However, sometimes positions are listed with their working title first. Like this position here where it says harm reduction care coordinator, that's the working title. The actual classification for this position is coordinator special programs. So you may scroll through and try to find epidemiologists, but it's best to just kind of look through the whole list or use some of the filters to help you find those specific titles. So this is what our site looks like. It will list all of the permanent positions first, then our ongoing roles. Ongoing positions are positions that we're always collecting applications for or accepting applications for them, but there may not be a current opening at the time that you submit your application. These are positions that we typically have a lot of vacancies for. So it's something that we're usually constantly using. So what you're considered for, you may not actually know what you're being considered for until you hear back from a hiring manager. We also have our contractual positions that are listed next on the site, which we have quite a few of those, and I encourage people to apply for contractual roles because it is a good way to get your foot in the door. We have a section that's reserved for current state employees only, so you must be a current state employee. Sometimes there are some other stipulations associated with that. May make it as specific as you must work within a certain unit or program. And then we have our internship opportunities. So actually right now we are accepting applications for our public health workforce development internship program. We will be accepting applications through November 15th for the spring term. And the spring term operates from February 7th until April 30th. And it is a paid internship program, as you can see here. And it is for, I see I have one question. Yes.
Yeah, so I recently applied to the internship program, the health policy intern role specifically. I was wondering what the application timeline is for that, especially in terms of hearing back to know if you're been invited to interview.
So the application closes on November 15th. We allow a few days for us to go through all the applications. The hiring managers should have those applications by the end of that week. So by the end of next week, the hiring manager should have the applications. And at that point, they'll go through and determine who they want to interview. So we're hoping that they have a decision by the end of December. We put it for mid-December, but at the latest by the end of December.
To make final selections or to begin interviewing?
To make final selections.
Perfect.
So
Okay,
the interview process will have to happen rather quickly.
got it. Okay, thanks.
You're welcome. So with that, like I said, it runs from, yes, I see another question.
Hi, my name is Yami Le, and I'm also applying for the internship, and I'm interested in maternal child health. So I know that there's like a section where you name your interests, but I was wondering how much of an availability there is within the department to work on those issues.
So in each of these descriptions, it should tell you an idea of some of the different programs that are participating. Usually these are the programs that have signed up front. Sometimes we have some that sign up a little bit later, but so it should give you a snapshot into that. Off the top of my head, I can't recall how many people signed up. I think we may have only had, if any, from maternal and child health. I think we may have to have one slot for maternal and child health at this time.
And would you recommend applying within a specific one of these types of internships? Like I was also thinking of applying for the health policy because I'm also interested in health policy, but like would community health be more appropriate if what I want to work on is maternal child health, or will that placement kind of come later if I apply to any of them?
So apply to all of the categories that you're interested in to sort of maximize your chances of being selected. Like I said, if you read each description, it does in that main purpose give you there's a section that briefly talks about the types of projects you may be working on. And it also references the programs that are participating. So within community health here, and sorry, this date needs to be updated. Not this date, but this date needs to be updated to April 30th. But under the main purpose, it says internships may be available within the following offices and programs. So here it says Dorchester County Health Department, the Maryland Primary Care Program Management Office, and the Office of Oral Health. So that tells you some of the programs that have signed up within this category.
Okay, thank you.
You're welcome.
I have one more question about the internship.
Sure.
How many folks typically apply for the health policy intern role?
We have a lot of applicants for the different roles. I can't really say an exact number, but we do have a great interest in those.
Okay, cool.
But not to have that deter you from applying.
No, I've already applied. I'm just always curious about like the competitiveness of the programs.
Yeah, and like I said, sometimes we have some programs that that express interest in participating sort of after the fact. So we actually may end up having more openings than we started out with.
Yeah, okay.
So as you see there, These are all the different internships from the Public Health Workforce Development Internship Program. And this program runs from the fall, spring, and summer. Again, this is just for the spring term. We haven't established the date yet for the summer, but be on the lookout for that if you're looking for summer internships as well. And we put that on Handshake. So all of these postings typically go on Handshake and through some other platforms as well, and shared on our social media. So there's different ways to find out about it. Okay. So going back to that slideshow. So as I mentioned, there's different types of postings. Here it's references regular active recruitments. This is sort of what it used to say on our website, but the regular active recruitments, it's referring to the merit positions. The ongoing recruitments were the ones that I mentioned that we're always accepting applications for. Contractual recruitments, contractual active recruitments, and then contractual ongoing. We don't really have any contractual ongoing at this time, but that's similar to the regular ongoing. They're just contractual. And then state employees only. And then currently we also have the openings for internships. One way in which you can keep up with all these different openings is through a feature we have called interest cards. The interest cards is this sort of an alert system where you can sign up to receive alerts for various classifications. So here's a link to the interest cards. You can go there from the jobs page as well. At the top here, you'll see a link. It says interest cards. So if you click that, that will take you to the same page. So with the interest cards, you'll select the different categories that you want. So for example, if you're interested in master's degree and public health, and then maybe you also want to put biology, chemistry, then you'll submit those selections and it will give you all of the different job classifications that fall into those categories, which will be a very long list. If you have an idea of what you're looking for, you can skim through it quickly. Otherwise, if you just want to take your time and go through it to see what falls into those categories, you can click on different things and read what's called the class specification. That will give you a general overview of what that position typically entails. And I see I have a question.
Hi, yeah, I was just wondering about the timeline with regards to applying to like one of these jobs as opposed to like internships. What does the timeline look like for applying to a job within the department?
Okay, I will actually get to that in just one moment. So I'll finish going through this and that should be coming up shortly. And I'll address that timeline in just a moment. So with these interest cards, like I said, you select the ones that you want. You can see the class specification, which just gives you the grade, the nature of work, examples of work, knowledge, skills, and abilities, and then the minimum qualifications for those roles. So that's what you would need to qualify for that position. These are just general overviews of what these positions typically entail. They're not a specific job announcement. But it's just to give you some background on the job classification. Once you've selected the different classifications that you want, you'll hit submit. It will prompt you to put in your email address, and then you can receive alerts. Those alerts will be sent to you for 6 months. After the 6 months, you'll have to renew those alerts. So if you know excuse me. If you know you're interested in health policy, you would select the health policy ones. For the internship program, it's a little bit different. For the Public Health Workforce Development Internship Program, the classification that we use is called contractual hourly. And that may not show up here. So you kind of have to play around with that one. I think that will show up if you put in contractual, but it won't show up under internships.
Yes.
So then once you've determined, you're interested in applying, we ask you to create an account on our site. When you create that account, you can create an application template. With that template, you can copy it into various applications for positions that you want to apply for. You can just use that template, or once you say you're interested in policy and epidemiology and you want to have a different application for each, you can copy your epidemiology applications over for all of your epidemiology postings and then copy all of your health policy applications over for those postings. So you can tailor your applications to different roles. Right. So just so you understand the job announcement, just really quickly, I'll bring up one. So here's what our job announcements look like. They start off with the department, the date that the position opened, the filing deadline, the salary for contractual positions that will be listed as an hourly rate, employment type, whether it's full-time or part-time, the HR analyst, that's the person that's responsible for reviewing your application to ensure that you meet the minimum qualifications, and then the work location. So that will give you the county where the position is located. Here at the top, again, sorry, there is the classification. Sometimes the working title is here instead, and the classification will be down below. Here, because it's contractual, we indicate up here that it's full-time contractual, and the recruitment number, that's what you would reference when you are, if you have a question about the position or if you need to go back and look for it, that's the number that you would reference. Again, the grade is referenced down here. Under here for location, we get a little bit more specific about the program that it's located in. This position is with the Prevention and Health Promotion Administration in the Division of Outbreak Investigation in Baltimore. We have the main purpose, the minimum qualifications, the desired qualifications. The selection process just talks about submitting your application and how we will not accept incorrect application forms. So if you submit some other type of application that's not ours, we won't accept it. Resumes are not accepted in lieu of a completed application. You must complete the state application. Again, a snapshot of the benefits, and then further instructions. So just some additional information about, like, if you need help, who you can contact for help with your application. If you need to attach additional information, just telling you how to attach that information or how to send it to us with your application. So going back up here to the desired or preferred qualifications, these are things that the hiring manager may be looking for in their ideal candidate. They're not required, but these are sort of like the nice to have things, or the things that they would really like a good candidate to possess. All right, so this is where we address the recruitment timeline. So the recruitment process, once the position's posted, we typically post the position for 2 weeks. Sometimes we may have it out there a little bit longer, maybe a month or so. But once the position closes, we allow up to 3 weeks from the closing date for our analysts to review applications. This is a little bit different for contractual positions. Once the position closes, they usually allow like maybe 2 or 3 days, and then they give the list to the hiring manager. Because with contractual positions, we just give the list to the hiring manager first before we review the candidates. And then it's sort of a reverse order. The hiring manager determines the rest of the timeline. So once they've received that eligible list, for our merit positions, you'll receive a notification whether your application was approved or not approved. If you were not approved, it'll say on your notice if you weren't approved because of education, experience, or things of that nature. So once the hiring manager gets that eligible list with the approved candidates, it's up to them to figure out when they want to conduct their interviews. So this whole process, if a hiring manager starts interviewing shortly after they receive that eligible list, the whole process could take about 2 months. If you're talking about from the time that you submitted an application to the review of the applications, it could take about I say about a 2-month time frame. It could be a little bit shorter, it could be a little bit longer, so it fluctuates. If the position is open and continuous, which I had mentioned before, they do not close. There's no closing deadline. You can submit your application at any time. Those applications are reviewed periodically or as the eligible list is requested. So analysts will go in and just review those applications maybe each week, but also if someone requests for that eligible list, then they'll review all the candidates at that time as well and pull that eligible list for the hiring manager. Once you are placed on an eligible list, you will remain on that eligible list for a period of 1 year. So that list remains active for 1 year. So during that time, you could be considered for other vacancies outside of the one that you applied for. So if you applied for Community Health Educator 1, and it was located at the Howard County Health Department, there may be another program that's looking for a Community Health Educator 1 that may want to use the same list, and rather than posting the position and waiting. So that kind of decreases their timeline. And it also allows for candidates that maybe weren't considered for the initial vacancy that they applied for to be considered for other vacancies. Some tips for applying, some do's and don'ts. And these things may sound like common sense, but they're often things that we encounter when we're reviewing applications. So just read carefully, make sure you comprehend what you're reading, take time to review your application and create your responses. Again, desirable qualifications are preferred but not required, and they help to determine best qualified candidates. So when you're placed on an eligible list, you're placed on the list as either best qualified, better qualified, or qualified. And this is typically based off of a rating that's done by the recruitment analyst. And oftentimes they use those desirable qualifications to assist with those ratings if desirable qualifications are present. Sometimes there may not be any desirable qualifications, but a lot of our positions do have them. Selective qualifications are qualifications that are required in addition to those minimum qualifications. So these may be something exceptional that the hiring manager feels is necessary for that role. So for example, maybe the position typically asks for 2 years of experience in a health setting. And then maybe they'll ask for one of those years of experience to be supervising or something. Like it'll be a little bit more specific, or they might go into more in depth about that particular experience, or it could be about education. Maybe the position asks for a bachelor's degree, and that selective qualification could be a bachelor's degree in health economics or something. So the other thing that you want to be mindful of are supplemental questionnaires. They must be submitted even with paper applications. The supplemental questionnaires often address those desirable qualifications, those selective qualifications, or any other things that we're looking for when we're looking at your application. It's your chance to expand upon that experience. So don't copy and paste from your resume. Don't copy and paste from the entries that you've already put on your application. It's your chance to go beyond that and to get more detailed and more in depth about that particular experience that they're asking about. And that's your chance to stand out for different things that the hiring manager is looking for. We also say it's important to keep an electronic copy of your transcripts, both undergraduate and graduate, on file. In the event that we're asking for a copy of it for a certain position, we have some positions that require you to have certain credits that we need to verify. So it's just good to keep a copy of those things. Sometimes people don't keep copies of them, and it takes them some time to obtain a copy. So it's always good to keep a copy on file, and they don't have to be official. Keep updated copies of your certifications or documentation of your certifications, so any verification pages. Keep those as well. I know for our clinical positions, a lot of times we need to see a license. The boards don't necessarily give people paper licenses anymore, but if you just provide us with that license number, verification page, that's helpful in us determining if you meet minimum qualifications. And again, carefully read through your whole application. just check for some like spelling errors or missing words, or just making sure that things make sense. And then have someone else read your application before submitting it. It doesn't hurt to have another set of eyes to look at your application. Use spell check. Sometimes people don't use spell check, so that's just something simple you can do just to avoid certain errors. Answer all questions. If a question doesn't apply to you, put NA. Don't try to put something else there instead. Again, do not put C resume on any part of your application. Don't copy and paste your resume to answer supplemental questions. Include all dates of employment and hours worked. So if you do have work experience, please indicate the hours, the dates and hours that you worked, because on our applications, it's calculating your length of employment. And if you don't put that there, we can't give you credit for it. If the date's incomplete, we can't give you credit for it. If you don't put it in the correct format. Also, if you work somewhere part-time, it's calculating it based on your hours you worked part-time. So if you work somewhere for 1 year, but you only worked 20 hours per week, that's going to count as 6 months of experience. And also just be consistent in the information that you're putting on your application. Make sure everything matches up. If you put something on your application and then you put something else on your supplemental questionnaire that you're referencing and it doesn't go together, we may not know what to give you credit for. So just be consistent in the information that you put on there. And then if you attended a foreign university, and it's something that you need to receive credit, please submit your foreign credential evaluation from an accredited company. So we utilize NACES, which is the National Association of Credential Evaluation Services. So those are some reputable companies there where someone can get a foreign education credential evaluation. Now, just some important links listed here. Our homepage, health.maryland.gov, our job postings, which is that Job Apps Cloud. That's where you can find all of our job listings. If you want to see those class specifications that I mentioned, this link here will take you to those. To see the benefits, this link will take you to all of our benefits. And then if you need to see that list of the different foreign education credential evaluation services, you could reference that here. Right. Anybody have any questions?
I have a question for the internship. I just want to confirm that remote positions are available.
Yes, there are remote positions available as well as hybrid and some in person. I don't think we really have many that are fully in person. Most of them are either hybrid or remote.
Okay. There's a section on the application where it requires you to choose a county that you're interested in working in. But if I'm applying for a remote position, is it okay if I just choose the first county because it doesn't let me skip that question or enter NA?
You can just select either all of the counties or put Baltimore City sort of as a default, because even if it's remote, we still have to put in a location on our end in the system. So just put Baltimore City.
Okay, thanks.
Okay, I have a clarification about the application timeline for the internship program.
Yes.
So by the end of next week, they'll get back to HR about who they're interested in interviewing.
No, the end of next week, all of the hosts will have all of your applications. So they'll be in possession of your applications because it closes on the 15th. So by the 17th, they should have your applications.
Okay, and then in terms of when they'll then reach out to applicants, that varies depending on their timeline?
That will vary, but ultimately a decision should be made by mid to end December. So they have about a month to make a decision.
Okay, got it. And then I was looking at the interest cards and there were positions about trainee roles. What does that mean?
So trainees are usually entry-level roles. So some of our classifications, we have our agency budget specialist trainee, agency grant specialist trainee, we have our HR specialist trainee. Those just require that you have a bachelor's degree. I know recently our requirements have even changed for that, but a bachelor's degree would suffice for any of the training roles.
Okay, cool.
Do we have any other questions? I don't know if there were any in the chat box. I think we already answered those. Right, if nobody has any other questions, if you think of something after today's presentation, please feel free to reach out to me at sandy.english@maryland.gov. And I'll be happy to answer your questions.
Thank you so much, Sandy, for taking the time for those detailed explanations, especially for the questions that were asked. And thank you all for joining us. We will have our next session happening at noon. And as Sandy shared, if you do have any questions, feel free to reach out to myself or her. You all have a good rest of your day.
Thank you so much. Take care.
All right.